New information and so many moving parts after the president's press conference. So how concerned should you be, and how effective and efficient is the federal government's response when it comes to this kind of scenario? We're going to break it all down with the help of Chief Medical Correspondent Dr. Jen Ashton and ABC News contributor and former Homeland Security Advisor for President Trump, Tom Bossert. Thank you both for being here. Tom, I want to start with you. We heard from the president today talking about how they are testing as needed. But when we hear those numbers, as many as 400 people with coronavirus in Italy, are we testing people when they come into this country from Italy?
Yeah, so testing is key, and I'm going to broaden it to what we call surveillance in this space. And I know Dr. Ashton will talk about that in a moment. But just testing at airports is a key factor, but not sufficient. What we have to do now, and it's not necessarily a criticism today, but it's going to become one if we don't quickly get our act together, is get our testing capacity and capability up to snuff in the coming week or weeks. And I think the CDC is promising that they've got a plan for that, but I think we'll have to pay attention and kind of check back in about 2 weeks to see if they've got it together.
And so, Jen, only 12 jurisdictions at this point even have the capability to test?
Right, and this is where I want people to hone in, Lindsay, because when you talk about numbers, you can't understand a given number without understanding the denominator. So, for example, when you hear numbers being reported worldwide, okay, we don't know how many people were exposed, how many people were infected, how many people were tested. Let's just say China or other countries, right. Middle East, Europe, how many people were tested. Of those tested, how many tested positive, and then severity and fatality rate, right? When you shift the focus to here in the US, right now, and I'm in touch with practicing clinicians, top infectious disease clinicians in this country in various cities, right now, they can't test whomever they want. That's both a good thing and might be a problematic thing. To Tom's point, you can't do surveillance if you're only testing a small number of people. You won't fully understand the spread of this virus. So right now, the CDC and the State Department have not yet changed their testing criteria. So they're saying, have you been in China in the last 14 days? Have you had direct contact with someone who's been in China or has been sick with coronavirus in the last 14 days? And do you have fever, cough, shortness of breath? Then what happens is you're put under suspicion for having the novel coronavirus and you're tested. If you just went into an emergency room, you, Lindsay Davis, and you had a fever, cough, shortness of breath, you would be tested, and rightly so, for influenza and other respiratory pathogens. If that were to all come back negative right now, that's where the testing would stop. And if you had just gotten off a plane from Italy, that's probably where the testing would stop. There have not been formal guidelines yet to say, because it's in a lot of countries now, if you've been to any country where there's coronavirus, you should be tested. And again, we don't know how many people are going from different countries on their way in here. That needs to be clarified because to say we only have 15 cases, 16 cases, 53 cases, doesn't really mean anything till we know how many people are being tested. So that is something that, as Tom said, they need to get that locked down sooner rather than later.
And what's the incubation period? Because again, if I've just gotten off the plane from Italy and they test me and I don't have a fever right now, and then I go into my community.
That's right. So what you're hearing in large measure, and this has been reported clinically in the New England Journal of Medicine, is 14 days. You're hearing 14 days, 14 days. Dr. Robert Redfield, the director of the CDC, today, in his testimony in front of Congress, members of Congress, said there have been reports up to 18 days. There are other medical journals who have found patients testing positive for longer than that. So again, everyone likes to say they have all the answers here. It's very important in medicine, public health, and science to feel comfortable saying when we don't know something. And right now, this is a brand new situation, only about 2 months old in this particular strain of coronavirus. No one has a crystal ball. No one knows what's going to happen in 2 weeks or 2 months or in the middle of the summer. But the testing is key, and the transmission dynamics of this virus are really important, and a lot of that is still to be determined.
Tom, I want to bring you back in. Curious to know, did you hear the same message? Did you feel that it was consistent between Dr. Schuchat at the CDC and President Trump? Just for example, Dr. Schuchat said, this is a good time to prepare. The trajectory is very uncertain, versus President Trump, who said, we have it so well under control. We really have done a good job. We are doing great.
Yeah, I think the president tried to hedge a little bit and do a little bit more of a political defense of his team and the actions they've taken to date. So there might have been a little room between them. You know, there's kind of three things I was looking for the president to do tonight. One of them is to not overpromise. One of them was to not over-reassure. I think he did a really nice job on those two, to be honest. The third one, though, was for, as a leader, was for him to set future expectations. And on that point, I think he perhaps hedged a little bit too far or too close to the this is not a problem, this is still low risk. Although, you know, Dr. Ashton's right, nobody has a crystal ball. Most of the medical experts that I talked to today and over the past 2-3 months and years, they're starting to worry that the regression models suggest that we will have, you know, a spread of this disease to some large magnitude in the United States.
And last question for both of you, and Tom, I'll go to you first. How do you walk the fine line? I mean, the people are obviously concerned and maybe even scared. How do you say, hey, let's be prepared without causing people to be panicked?
Yeah, I think, you know, you do two things. You never make fun of people for being scared or afraid. That's normal, and I think that's okay. But in any crisis, you have to maintain trust with the public. And the way to do that is to tell the public everything you know, everything you don't know, and to not tell them things that you speculate on. And so there's really an easy way to maintain public trust here. It's easier said than done often.
Jen, same question to you.
Yeah, you know, I think Tom would have made a really good physician, actually, because that is exactly what we try to do when we're taking care of a patient. You know, in a situation where someone feels like they have no control, it's important to try to give them actionable tips, things they can do to feel like they have some control over their environment, over their immediate future. Sometimes we know those things and sometimes we don't. But again, I've said it from the beginning, in medicine, we have to prepare for the worst and hope for the best. And so hopefully that's what we're doing here.
We heard from the president and CDC, washing your hands, still the best move.
Very important.
And staying home if you're sick. Dr. Jen, Tom Bossert, thank you to both of you.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.